We expect today to hear the Alberta government's next move as it deals with a surge of COVID-19 in the province. It's expected, as early as this morning, to unveil tougher measures as it confronts days of record-setting numbers. The number yesterday, the second straight day above 1,500, 62 people in ICUs in the province. At the briefing yesterday, the province's top doctor, Dr. Dina Hinshaw, urged the province to take action now.
This is like a snowball rolling down a hill, growing bigger and faster, and it will continue unless we implement strong measures to stop. We must take action. Waiting any longer will impact our ability to care for Albertans in the weeks and months ahead.
The province is also facing mounting pressure from hundreds of doctors who have released another open letter, another of several in a series, calling for a lockdown to reverse the trend, to save hospitals from being overwhelmed. We want to try to bring you a fuller understanding of what is happening in those hospitals. Dr. Darren Markland is with me. He's an intensive care physician and nephrologist at the Royal Alexandra Hospital in Edmonton. Dr. Markland, welcome to our program.
It's nice to be here. Thank you.
You heard a little clip from Dr. Hinshaw at the briefing yesterday, that snowball analogy, rolling down the hill, growing bigger and faster. She also said Alberta is in a precarious position. What do you think of her assessment?
I've been watching Dr. Hinshaw for weeks, and this is exactly what she's been saying for weeks. This is simple math. We've seen it coming for a long time. And now we're experiencing it on a first-hand level in our intensive care units.
So what are you experiencing? What's your day-to-day like?
Very different than it was 2 weeks ago, and that's what happens when you're on an exponential growth curve. We are seeing sicker, younger patients, and we're admitting 2 to 3 of them every day. The easy ones aren't there anymore. Our ward staff, our ward physicians, our COVID units are doing fantastic work. So by the time they come to us, there's nothing left to do but put the tube in and ventilate them. So
sicker, younger, but in terms of more, how close is your hospital to capacity right now?
So that's a tough question. We always are running tight. That's just the nature of the business in intensive care in Canada. We have the least number of beds per our unit per capita, but we run them really well, and we tend to manage them well. We have no give in the system. We've already shut down elective surgeries. We're reducing the non-essential kind of elective ICU admissions. So what's coming now is the stuff that's going to stick. And we are full from that perspective. We're at 90%. We have a surge plan, but that means changing the way that we deliver care. And quite frankly, it's not the same care that you're going to get that you got a month ago if you're in the unit.
Interesting. I was reading in the Calgary Herald, an ICU colleague of yours in Calgary, similar concerns to what you're seeing in Edmonton, raising the possibility there about hospitals being in the position of having to make life or death priority choices for patients in terms of who gets the beds available. Are you in that situation yet, or is that a concern that you could potentially be?
So as an intensive care physician, you're always trying to decide who's going to benefit from care. Everyone, you can save most lives, but will you make people better? We're already making some of those decisions about very ill or very frail patients, which is part of the reasons why our beds haven't been overwhelmed. But as resources dwindle, the criteria for getting in means things that we could have saved, that could have gotten out of the ICU, those patients then become put aside for other ones who will have more benefit. That's triage, and we don't want to get there.
How long until you get there?
The numbers are clear. Without any interventions, our ICUs will be overwhelmed by the end of December. And we will start phase 3 of our surge plan, which is not a standard ICU. This is basically protocolized medicine where I direct people who direct people to direct care.
So without any interventions, I was mentioning in introducing you that the province is set to introduce what we believe will be tougher restrictions today. What do you want to hear? What help do you need?
To be absolutely explicit, since we've lost contact tracing weeks ago, there is no room for these so-called directed measures. We don't know what we're directing at anymore. We need to get our contact tracing back, and to do that, we need a shutdown. The idea of economy cannot live in a vacuum. It needs social supports and people who are healthy to work. We need to shut things down, and we likely need to shut schools down for a period of time until we can get the numbers down.
How long? For how long? I mean, some are saying the circuit breaker for 2 weeks, and some say that's not nearly long enough.
You know what? If you were asking me this 2 weeks ago, when that letter came out, 2 weeks to a month may have worked. But the nature of exponential growth is, even if we shut it down right now, we're going to see 2 weeks of incredible surge. And that will take out workers, and that will understaff the hospital, and that will cause loss of unnecessary life.
So shut it down from a business perspective, non-essential business perspective, and potentially schools. What do you think of the way Alberta's government has handled this so far?
I'm a physician. I need to work with my government, and I try to stay as apolitical as possible until lives become sacrificed. And that's why I'm a co-author of many of the letters, as of my colleagues are. I think our Minister of Health I think our Chief Medical Officer has made very good suggestions, but I feel that perhaps these have not been listened to in a timely fashion.
And there have been calls for what she's been putting forward. As she says, she is just the one to make the recommendations. It falls to the government to implement whatever of the recommendations they choose. I'm wondering, in all of this, of course, in recent weeks, we've had encouraging news, as it's been described, about 3 now potential vaccine candidates. Given the situation that you are in, how do you view this news about vaccine potential?
Well, here's the thing. In wave 1, we did the right thing, and we had no idea there would be a solution. I understand COVID fatigue, but now we have a finish line in sight. We can now clearly budget how much we have to withdraw to make it safely there. These vaccines work. They are independently studied. And yes, I'm still waiting for the peer-reviewed data, but we have 3 different companies which are doing things which make sense. Physiologically and by the numbers. We got to get through, because when we have a vaccine, things will get better, but it's going to take a year and a half to get all people vaccinated if they choose to do so.
We'll be paying attention when the government announces its latest moves, and Dr. Markland will be in touch to find out what you think about that. I really appreciate your time and perspective this morning. Thank you.